Welcome to this. This is the second in our four-part series of webinars exploring place efficiency. So a reminder that if you want to attend future webinars, please sign up for each one that you want to attend. So I'm Wendy Russell. I'm a Senior Research Fellow at the University of Gloucestershire, and I'll be chairing the proceedings for today. It's great to see so many people. And the people that are registered, I know there is a range of professional sectors from lots of different countries. It's great to see international interest in the idea of place efficiency. And so I'll give a particular nod to those of you who have stayed up late or got up early to join us from the other side of the world. As with the first webinar, this is in webinar format, so your cameras and mics will be off and all communication will be through the chat. We had some feedback from our first webinar and we agreed with you as well. We have changed the chat settings so you can see everything that's posted publicly and you can talk to each other as well. And Ben and Mike from Ludicology will be monitoring the chat, adding useful links and curating questions for speakers. There was also some other feedback from our first webinar, saying that there was some interest in a place efficiency network of some kind, where people can share experiences and ideas and questions. We think this is a great idea, and we are looking into how we might make this a reality. No promises, but watch this space. If you are interested, please can you say so in the evaluation form that will be sent to you. This webinar is being recorded, so you'll be sent a link to the recording after the event. I need to say a big thank you to the University of Gloucestershire for funding the webinars, and to Play Wales and Genero for admin and technical support, for which we are very grateful. The whole series is curated by myself and Mike Barclay and Ben Tawil from Ludicology. Our involvement in place efficiency has been right from the start, either in doing place efficiency and or researching it. So we've been doing that for getting on for 10 years now. Our first webinar looked at the history and some of the key principles of place efficiency. And this session is looking at what actually happens when place efficiency is there at a national level. So we'll be hearing from Ruth, Conway and Marianne Mannello from Wales about their experiences, and their place efficiency is part of their children and families measure in 2010. After that, we'll hear from Marguerite Hunter Blaire on what's happening in Scotland, where place efficiency is a planning issue linked to the place principle. Following this, there'll be a brief look at place efficiency at national level in a specific context, and that of healthcare. And so we'll hear from Adrian Voce from Starlight. And finally, Eugene Minogue from Play England and Alan Heron from Playboard Northern Ireland will reflect on what they've heard and what this might mean for their respective countries. We'll try and blend your questions into this session, in this final session, so we hope that that's going to work. This is a packed programme. What could possibly go wrong? So let's get going, shall we? Welcome our first speakers, who will talk about the Welsh experience. We heard about the early beginnings of place efficiency in Wales in the first seminar, and here Marianne and Ruth will be focusing on how place efficiency works in Wales. They'll talk a bit about the findings from research over the last 12 years and about the place of play in national policy in Wales. So let me introduce them. Marianne Mannello is an assistant director at Play Wales, which is the national charity for children's play, with specific responsibility for policy support and advocacy. She joined Play Wales in 2002, having been one of its trustees before this. She leads on place efficiency, children's rights, health and well-being, and neighbourhood play provision. Amongst other things, Marianne works with the Welsh Government and local authorities in Wales with regards to place efficiency assessments. And during the coronavirus lockdown, Marianne achieved a long-held ambition to master the hula hoop. And Ruth Conway is currently Deputy Director of the Early Years Childcare and Play Division within the Welsh Government. And she's been in this post for just over a year. She's a career civil servant with more than 30 years experience, and 17 of those have been in education. And during her time at education, Ruth held various roles which have involved working across Welsh Government departments, which provides a really strong foundation to build on in her current role. So welcome both, and over to you.
Diolch, Wendy, thank you. Just get my slides up. Hopefully that's sharing okay. And hopefully I'm unmuted, right? So, diolch yn fawr, Wendy, thank you for the introduction. As Wendy said, I'm Marianne Mannello from Play Wales. I'm joined by Ruth Conway to talk about the Welsh experience here in Wales. So, prynawn da pawb, good afternoon, everyone. If you're watching in the morning, bore da. And if it's evening where you are right now, noswaith dda. It's nice to welcome you here to Wales for a short period of time. I'm from Play Wales, which is the national charity for children's play. We champion every child's need and right to play, envisaging a future where play is valued for the crucial role it has to a healthy and happy childhood. A little bit about Wales. Our capital city is Cardiff. We have a devolved government known as the Senedd Cymru, which translates to Welsh Parliament. There are many policy areas devolved to Wales, and children's services, including play, was the first within the first devolution of powers. We have two official languages, Cymraeg, Welsh, and English, and our population includes just under 700,000 people under the age of 19. We have 22 local authorities and municipalities in Wales who have responsibilities around children's play. So I'm going to give you a whistle-stop tour of the history of play policy in Wales, and Ruth will join in with more up-to-date, exciting stuff that's going on right now. If you are interested in the history of play policy in Wales, we do have a timeline on the Play Wales website. Play Wales was established as a national charity in 1998, and around the same time that the new National Assembly for Wales was established. So we've kind of grown up together, looking after and promoting and developing play policy and having a role to play. So it's been a very fruitful and nice relationship across the years. In the very early days of the Senedd Cymru, Welsh Assembly Government established a play grant and commissioned a state of play review, which produced a report including a key recommendation that the Welsh Assembly Government consider developing a coherent policy framework on play for Wales. So in 2002, as far as we know, the first global international play policy was published by Welsh Government. It is a brief principal document which finished with a commitment to develop a strategy to implement the principles set out in the policy. In 2004, Welsh Government adopted the United Nations Convention on the Rights of the Child as a basis for policy making in Wales, and at the same time established a play policy implementation group. This was a partnership group to develop recommendations on how the principal statements within the policy should be developed. And a key recommendation from that report, from that group, was that the Welsh Government should place a statutory duty upon local authorities regarding children's play. So you can see the policy framework developing from over 20 years ago. Welsh Government then, in response to those recommendations, launched the Play Policy Implementation Plan in 2006, and in response to that recommendation around a statutory duty, committed itself to including in Children's Act planning guidance a duty to cooperate in addressing the play needs of local children. So from the early stages, collaboration, partnership, and cooperation around children's play are key guiding principles in our policy direction. Now, the last webinar looked more in depth in general comment number 17, but just as a reminder, the Committee on the Rights for the Child recommended that state parties consider introducing legislation around Article 31 rights. And as Wendy's already mentioned, Welsh Government became the first government worldwide to include in its legislative framework children's play through the Children and Families Wales Measure 2010. The statutory instruments around that include the measure itself, followed by regulations, which are known as the Play Sufficiency Assessment Regulations. And alongside that comes statutory guidance, which is guidance to local authorities, municipalities around their play sufficiency duties. Through the duties, municipalities complete a thorough play sufficiency assessment every 3 years. They complete annual action plans and progress reports on the efforts to secure opportunities for play in their area. I cannot overemphasize how important the word secure is here. Secure means that using secure rather than provide ensures that partnership approach, that local authorities are encouraged to work with town and community councils or parish councils, other tiers of local government, and the voluntary sector, which are key partners here in Wales. The wording secure also means that it doesn't negate us, all providers in Wales, from seeking funding from other sources for opportunities for play, for funding for play provision, because the word secure doesn't place it as a statutory requirement. So I hope that's useful for people. I cannot overemphasize how important that word is. Local authorities assess across 9 matters, diverse matters. There are over 100 criteria through the play sufficiency assessment template, and all of these documents are available on both Welsh Government's websites and via the Play Wales Chwaer Cymru websites as well. So basically those matters are mapped thematically. We start with who are our children, moving on to where do they play, and that this isn't linear at all. It's kind of very fluid. But who are our children? Where do they play? We look at the people who directly support children to realize their rights to play. And then there is a theme that looks at policy synergy. How easy is information? How accessible is information? How did the wider play workforce account for children's play? How is the community involved in opportunities to play? The current play sufficiency assessments were submitted in June 2022, and our local authority partners are feverishly working on the next play sufficiency assessments, which are due in a few months' time in June 2025. Since the play sufficiency duties were commenced, Play Wales has commissioned 4 play sufficiency research studies. In the first webinar, Ben and Mike talked briefly about Ashamin's register, which is a useful tool to critique our policies and actions and how we work across policy areas. And in that research, Wendy was one of the researchers alongside Ben and Mike from Ludicology, and they map to what extent the research has linked those registers to the ambitions of Wales being a play-friendly country. So the findings from the research in terms of repair and maintenance talk about the severe cuts that we've had to play services over the years. In terms of relatedness, it talks about the importance of partnerships across departments and sectors in supporting opportunities to play. In terms of rights, the research reinforces the importance of Article 15, the right to association, alongside Article 31 and Article 12 in terms of supporting children to realise their right to play, and that meaningful research with children is fundamental to getting it right for children. And in terms of re-enchantment, there is still enthusiasm here for the play sufficiency duties and has encouraged people to think differently about children's play. So the key themes in the research were that the play sufficiency duties have enabled the maintenance of a dialogue across local authority partners and departments around children's play, therefore fostering ongoing communities of practice. The play sufficiency duties have enabled us to embrace the concept of children's competence, and that we have a responsibility to supporting children to make the most of their play by making sure that the conditions are right. And a key message is experimentation. What happens if we do something slightly different to move things around a little bit in terms of children's play? The key findings, as I've already touched on, is the enthusiasm for the play sufficiency duty at local and national government levels. And Ruth will talk more about that in a moment. The concept of sufficiency is a process, not a product. There isn't an end to this. When these assessments get submitted in a few months' time, as I've already mentioned, there are action plans and progress reports around this. Play sufficiency is rights-based, and that therefore brings it in line with all of Welsh Government's policies relating to children and young people. The research demonstrates that play itself is valued now in the here and now for children, as well as being important for future-focused outcomes. And at national level, there is a role for Welsh Government to keep the processes of play sufficiency in good repair in order to support the conditions for local authorities to assess and secure sufficient opportunities for play for children. All of that is available on the Play Wales website, and I'm now going to hand over to Ruth Conway, who will talk more, bring us more up to date in terms of what's been happening in the last 5 years in terms of play sufficiency in Wales. Diolch yn fawr. Thank you.
Diolch, Marianne. So I'd like to just build upon what Marianne has been covering in the earlier slide, and just to talk a bit about the ministerial review of play. So in 2014, the Welsh Government set up the vision for play for children in Wales. That was with the publication of Wales, a play-friendly country. So that's statutory guidance to local authorities on assessing for and securing sufficient play opportunities for children in their areas. So since legislation in support of children's play as part of the Children and Families Wales measure back in 2010, between 2019 and 2022, the Welsh Government undertook an in-depth and collaborative review of its play policy work. And then we considered the progress made in achieving the Welsh Government's vision for play. And the review had two aims. First one, to assess the Welsh Government's work relating to play policy, and the second one, to help the Welsh Government shape how it develops and progresses the play agenda. So the Ministerial Review of Play Steering Group report made key recommendations and suggested milestones for the Welsh Government to consider in building on the progress made in being a play-friendly country, giving children and young people sufficient opportunities to play. Next slide, please. Thank you. So the 6 key themes in this report focused on alignment of key legislation impacting on the right to play, the play sufficiency duty and funding, spatial justice, play work provision and regulation, workforce and qualifications, and last but no means least, play and education. So the steering group's report included a table of 15 key recommendations supported by suggested milestones on how the anticipated outcomes in the report could be achieved. Next slide, please. So the Welsh Government response to the steering group report was published in October 2023 by Julie Morgan, who was the then Deputy Minister for Social Services. The response explained how the Welsh Government intended to proceed in taking forward or exploring further the recommendations and suggested milestones. The response also set out the actions in response to the milestones which could be taken forward in order to achieve the steering group's anticipated results. Next slide, please. So out of the 67 actions set out in response to the ministerial review of play, 48 have been completed so far, and there are 19 remaining, some of which are medium and some of which are longer term actions. So to support the oversight of cross-policy working between play and other policy areas, we established an internal ministerial review of play implementation board. The board meets 6 monthly and brings together all policy areas in Welsh Government which have an impact on play, and it's comprised of policy lead members who are working together to review and progress our actions. We've also established the Welsh Government Play Champions Network, which supports cross-policy work in improving play opportunities for children and young people, and that group meets bi-monthly. So we work collaboratively with Play Wales and with local authority play leads as well to promote the importance of play and to support children in having sufficient opportunities to play. We have reviewed and refreshed the suite of play sufficiency assessment documents, and we've published an updated play sufficiency assessment form, a refreshed play sufficiency assessment toolkit, plus the statutory guidance for local authorities will be published shortly as well. So all this work will support the positive work that's been taken forward by local authorities in improving play opportunities for children across Wales. Welsh Government has continued to support the Playworks Holiday Project, which is a holiday hunger initiative, and that aims to support access to increased play opportunities for children and young people during the school holidays, and also provide healthy food and snacks as well. So we also published in July 2024 the reviewed and refreshed childcare play and early years workforce plan. And this is, this is a very brief summary of the work undertaken so far, and we plan to publish a full progress report in the coming weeks. Next slide, please. So this is an exciting time for play policy, where the actions we're taking forward will build on the positive work being undertaken across policy areas, and that's by local authorities and more widely with our key stakeholders. So we'll continue to work across policy areas to ensure play sufficiency is considered in relevant new and emerging policy areas. This includes monitoring membership of the Play Review Implementation Board, and I mentioned the Play Champions Group as well, and also to support cross-policy working between play and other policy areas. So we're committed in Wales to being a play-friendly country and to working collaboratively to support children's right to play and improve children and young people's opportunity to play. We build on the progress made and continue to explore work and take forward the actions. Last slide, please. Thank you. So this last slide just contains some links to some of the information I've shared with you today, and I'd also like to thank Play Wales as well for organising these webinars and inviting me to share with you the Welsh Government's continued commitment to play policy. Diolch yn fawr.
Excellent. Thank you so much, both of you. That's it's just so lovely to hear a national government so supportive of play. In my experience, a review is something to be feared because it usually means cuts. And I've had the privilege to be involved a bit in the Welsh Review of Play, and it's just, the commitment to it is just wonderful to see. So thank you so much for that. And we look forward to reading the report on your progress on the play review as well. The other thing, a couple of other things that I picked up from that I just want to emphasize is the idea of play sufficiency as a process, not a product. It's never ending. It goes on forever. But also just how long it takes to get things into place. You know, if you want to do something like play sufficiency, it takes a long time to get there. So thanks so much for that, Ruth and Marianne. We will move on now to hear about the Scottish experience. and who and what was involved in securing play sufficiency duty in Scotland, some detail on the Scottish duty itself and how it's enacted. So I'd like to welcome Marguerite Hunter Blaire, who is the Chief Executive of Play Scotland. She established the Scottish Play Commission in 2007 and led the campaigns for Scotland's play strategy in 2013 and for a statutory duty for play in the Planning Scotland Act in 2019. Marguerite is chair of the Play Strategy Refresh Group, a vice chair of Planning Aid Scotland, and secretary of IPA Scotland, that's the International Play Association Scotland. Formerly, she was CEO of Playboard Northern Ireland and Community Services Manager in Belfast City Council. So welcome, Marguerite, and over to you.
Thank you very much. And thanks for that lovely introduction. And hopefully that explains the slightly strange accent that I have. That was a wonderful presentation from Marianne and Ruth, and so uplifting, actually. And I love the word enchantment. But I also appreciate what you were saying, Wendy, sorry, about it takes a long time. It takes a long time. And it has certainly taken us a lot longer than Wales to achieve what we have now in Scotland. I'm just going to quickly remember to share my slides before I start blethering. So, yeah, basically we've taken a different approach, a different route, and I'm just going to take you through a 20-year journey in 15 minutes, so bear with me on that. Oops, I've done a different version of my slides here. I'm just not sure how to get them to move on. So just bear with me till I try and get them to move. So maybe.
Marguerite, I just clicked on the slide and it progressed.
Oh,
sorry.
Thank you so much. It's always the easiest thing. Okay, here we go. So our journey to play sufficiency in Scotland began back in 2007, and it will end in 2027 when all local authorities will have completed their play sufficiency assessments. So this is not a journey for the faint-hearted, is what I would say. But we started with a survey of local authorities back in 2007, and the wonderful John McKendrick helped us do the analysis on this report. And really, it shone a light on local authorities and their different approaches to strategic planning for play, the different resource commitments that they had. And while we acknowledge the right of local authorities to set their own priorities, which is quite right and proper, we also have the child's right to play and the need for them to have, as a bare minimum, adequate play opportunities. And we developed this theme further. We had made a recommendation at that stage for baseline information to be recorded in local authorities and held nationally. And we developed this theme further in our findings with our Play Commission, where we called for a national play indicator that would specifically be underpinned by statutory duty, and that it would have measures in it to record and monitor play opportunities in terms of accessibility, inclusion, affordability, quality, and children and families' satisfaction. And that's what we have now achieved in Scotland, but this has been a long journey. I'm not going to go into a lot of details. I'm just going to try and pick out a few highlights. When we didn't get this commitment to a national play indicator in 2008, we did what the play sector does, and we did it ourselves. And the wonderful Izzy Cole-Hamilton wrote Getting It Right for Play Scotland, which is a play sufficiency assessment toolkit for local authorities to improve local play opportunities. And over the course of the next 8 years, Play Scotland rolled that out to about 1/3 of local authorities in Scotland. And that made the case even more for statutory duty to be needed to ensure that everyone did it. We also put down a petition in 2012 calling for a statutory duty for play. We were trying to embed it in the Children's Bill, and preferably actually in the Community Empowerment Bill. And we do have mapping of play spaces in community empowerment, but it's buried pretty deep in open space strategies. and it's not a place sufficiency assessment. So the campaign had to go on. But the petition and giving evidence to the committee and having that evidence passed to other committees was a very good experience to build political awareness, cross-party political awareness of play. And it did result in a commitment to our play strategy, vision and action plan. And the principles of inclusion and sufficiency are at the heart of this plan, but there is no commitment to play sufficiency. So we continued then trying to build this political momentum for play by developing our inclusive play charter, which was built on the strong foundations of Play England's play charter. We did have permission for that. And we were delighted when a motion was put down in the Parliament to debate it. And the debate was extended because so many politicians wanted to talk about play and how important it was. So this then led very nicely in terms of timing into the review of the Planning Act in 2017. And of course, it takes a long time to review an act. It becomes a bill, there's amendment phases. And in the end, we joined forces with the Scottish Alliance for People and Places. We were the only non-planners in the room for a long time, but eventually we managed to persuade more people from the children's sector to join us. And we did achieve these 2 legal duties at the amendment stage of the bill. And it's worth mentioning Monica Lennon, MSP, who put the amendments forward, and the great minister who allowed them to go forward. So then we were asked to consult on the regulations and guidance of play sufficiency assessments, and something awful called National Planning Framework 4, which even now I find hard to say. And so first of all, we had to work out what did that even mean. And then we had to really bring the sector with us as to how we were going to consult with children and young people on this. And in the end, we had a massive response from children and young people. And I think over 1,000, one of the biggest responses government had ever received on anything. So children really got it, they understood it better than us adults, and they realised it was their future that it was at stake, as well as their current play opportunities. So Play Scotland then went on to carry out the first 2 local authority play sufficiency assessments in Scotland, and then we're able to advise all local authorities on the process and findings. And we're just about to publish the 2025 version of Getting It Right for Play, based on our own learnings as well. So how did we make the case for play? Well, we mapped it against positive outcomes that through play and placemaking, key outcomes that government are trying to achieve happen. And I've just put a nice slide there just to show what that means, and really tapping in and mapping against these key policy areas of poverty, education and health, and being very clear and succinct about what it is we were looking for. And I know you talked last time about General Comment 17, and that's been an enormously helpful document for all of us. Sorry. So what does the policy framework look like in Scotland now? Well, this is what it looks like. We've got the regulations and guidance in force. That's from December 23. We've got National Planning Framework 4, which is our overarching umbrella planning document in Scotland. The policies are mapped against local development plans. So when a local authority is doing their local development plan, they map their plan against the policy area. So for the first time ever, and really because children and young people took the time and trouble to respond to NPF4 consultation, we have a policy area for play and planning. We've got full incorporation. I suppose it's worth saying about the Planning Act and Planning Framework that these do not constitute a legal duty for play. That comes through UNCRC full incorporation, which happened last year. And we've got our new vision statement and action plan, and we'll tell you a wee bit about that at the end. It's not launched yet, so I can't say too much about that. So this all informs the work of Play Scotland. And again, people can look at these slides at their leisure, but the domains in the play strategy are play at home, early learning, childcare in school, and in the community. So the part I'm talking to you about today is the work that we do in terms of community. So the Planning Act was really important. It wasn't tinkering at the edges. It was a fundamental change in engaging and empowering communities, including children and young people. It was about removing conflict, establishing collaboration, introducing local place plans, and requiring consultation and participation in local development plans. And you can't sit on a planning committee in local government or in government if you haven't done the training on the planning system in Scotland. So these are huge strides forwards for us. What does the play sufficiency require? Well, back to what we were asking for in 2008, it asks for mapping, creating baseline mapping information. It talks about assessing regarding quality, quantity, accessibility, consulting and publishing this evidence report that goes forward into the local development plan. It's for all children and young people, all ages 0 to 17. We have been particularly looking at spaces for girls, children with disability, other protected characteristics, and deprived vulnerable communities. Because we've done a lot of consultation with children and young people, it's really interesting. In our last report that we put out in 2023, children consistently give the same messages. And a lot of what they're asking for actually makes better places for all of us to live in. And we know that. Gilles Penaloza said it himself many years ago, but it's true. They're not asking for destination parks on their doorstep. They're not asking for anything outrageous. What they're asking for actually is what makes every community a better place to live in. And this is what National Planning Framework 4 is all about. It's our national spatial strategy. It delivers sustainable, productive, livable places. It's about living well locally. And that's exactly chimes so well with place efficiency assessments. And so this is the policy line here that fits very nicely into place efficiency. So what does that look like in practice? But I'm taking this quote from the wonderful Edith Curry, who's a senior planner with Glasgow City Council. She led on the place efficiency assessments in Glasgow. And what she's talking about here is this collaborative co-design approach that we've been pushing from Play Scotland, and others have pushed it as well over many years in Scotland. It's not just about place efficiency assessments, it's bringing young people into the conversations about what it's like to live in their area and what you need to live well locally. And for this wonderful work, I know she's coming up in the webinar series later. I'm not going to steal her thunder, but she received the Planning Excellence Award for Scotland for her place efficiency assessment work and a Play Scotland Play Champion Award. So we now have this new document coming out very shortly, which supports local authorities to fulfil their duties. This is, oh, sorry. Oh, I don't know how to go back. But anyway, it's there for people to see later on, but it's, I'm just using a different method here, so I'm sorry, I don't know how to go back. But it has 5 tools and 10 indicators, and that's how we recommend the mapping of place efficiency is done in Scotland, in co-production and co-design with children and young people. There is a great appetite for it in Scotland. Why? We waited so long. Why now are they so interested? Well, because you need the evidence to complete your local development plan. This is so important now. And there's a lot of work in it, which is great. But what we said all along is once you've done this work, you add to it. You know, a lot of this work never needs to get done again. It creates the baseline for moving forward. And we all know this. Other people could speak more eloquently than me on this, but children play everywhere and anywhere. You only got to look at a bus stop, supermarket, B&Q on a Saturday morning. Children play anywhere. But obviously mapping informal play spaces can be quite difficult. The formal is easier. And so in our toolkit, we talk about recognised play spaces, the spaces that children tell us they like to play in. And what we suggest is you can use the same tools to map informal as formal. So there's lots of tools out there. These are only some of them, and they've been a fantastic asset to us on our journey to get to where we are. When our government officials, the wonderful Kwan Lowe, who's a senior architect in government, discovered the design guide for play from Play England, she was just blown away by it. And I was so pleased that I have hard copies. So if anybody wants a hard copy, I've still got a box of them somewhere. But no, a lot of really good tools out there. And this wonderful example of Catherine Street Inclusive Play Park in Dumfries. People call it an outside community centre. So this is what we're trying to get to, something that's actually good for all the community. This is what success looks like. So very quickly, I'm allowed to say a wee word about the Play Vision Statement and Action Plan. And the bit I want to tell you about it, it's about to be launched in March, is that it now contains a play theory of change. And one of the primary drivers is places. So we're just absolutely thrilled about this huge recognition of the importance of place for children's play. So that's my quick journey through a long time. It took us a lot longer to get to where we've got to than Wales, obviously. So well done, Wales. But I'm happy to take any questions at the appropriate time. and the slides are available if anyone would like them. Thank you very much. And thanks for asking me, Wendy and Ben, for coming along to do this today. Thanks very much.
Excellent. Thank you. Thank you so much, Marguerite. If you'd like to stop sharing your screen, that's wonderful. Some things that I've picked up from that, not a journey for the faint-hearted. You do have to be very persistent, don't you, in getting this into legislation. And I think the differences between Wales and Scotland show that there is no template for this. And if people are thinking of going through this nationally, then I'm hoping there are some things that you can take from this, and your own situations will be very different. One of the things is that I picked up is that local authorities were doing this before they had to.
Yeah.
Which is sorry.
I would say about a third, 11 out of 32, which I'm being generous in saying a third. But
okay.
But again, I would have said some did different aspects of it. Some were focusing on policy, strategy. Some were very interested in a particular aspect. What do children think of things, or, you know, consultation. It really needs to all be done, you know, and I think that's what the lesson that we learned along the way is that the law itself doesn't make this happen. That's the implementation phase. Yeah. But you need the law to make sure everyone does it, and it has to fit into things. And I think that was something we learned from Quan Lo in government, is the circles have to all be completed. So the evidence report, yes, that's lovely. Where's it going? Where does it feed into? And how does that relate then to this national planning framework for which a lot of us might not be knowing anything about if we're not a planner? So it's, where does it go? How does it fit in? And that's how you build the sustainability in. You know, if it sits out on its own, it's just going to get chopped off or get lost, you know. So.
Lovely. Okay, thanks so much. I think there's an awful lot of ways that you can do place efficiency, and there are big differences coming out between how it works in Wales and how it works in Scotland, and I think that's rich pickings there for some debate for the panel later. Thank you so much, Marguerite. That's great. Okay, let's move on now. Something slightly different now, to rather than looking at place efficiency in national policy generically, we're looking at place efficiency from a national perspective, but in a particular context, and that is the context of healthcare. So our third speaker is Adrian Voce. I'm really, really happy to welcome you, Adrian. Thanks so much for being with us here today. Adrian is Head of Policy and Public Affairs at Starlight, which is a charity that supports play in children's play in healthcare settings. You might say a bit more about that, Adrian. And he's been working closely here with NHS England and lobbying the government to recognise and support children's play in healthcare. But he didn't start off in health. He started off in play work, and his long career has included work on adventure playgrounds, and one of that very recently on Lollard Street. He was also the first director of both London Play and Play England, where when he was at Play England in the 2000s, he led the campaign and worked with the government to deliver the national play strategy in England, where it had 2 glorious years before it was abandoned when the coalition government came in 2010. Adrian is also the author of Policy for Play, Responding to Children's Forgotten Right. He has a master's degree in professional studies in children's play, and in 2011 was awarded an OBE for services to children. So welcome, Adrian, and over to you.
Thanks. Thanks so much, Wendy. It's really, really lovely to be here, and very inspiring to hear all the amazing work that's going on in Wales and Scotland. I'm waffling a little bit now while I try and sort out my slides. Not so familiar with Zoom. But we will get there. If I just click on here. How's that?
Perfect, thank you.
Good. All right, so Play for Children in Healthcare, an overview of policy in England. And although we're talking about this as an example of play sufficiency at a national level in a particular context, I think what we're going to find is that in many ways we're talking about play insufficiency and how we can go about changing it. A little bit about Starlight to begin, and I just need to click my timer so I don't go over my allotted time. Starlight is the national charity for children's play in healthcare, and we've been going for about 40 years. We were formerly a wish-granting charity, but we are now a charity that provides play resources and support for professional play practitioners working with children in the healthcare system across the UK. And increasingly, over the last 4 to 5 years, we've been developing an advocacy role to advocate for the importance of children's play in healthcare, both within the NHS and with the Department of Health at a policy level, which is where I come in. Policy for play in healthcare in England, well, we've heard a lot about the General Comment 17, which is an important document for all of us in play advocacy, of course. Perhaps not quite so widely known. Comment makes a very explicit link between children's right to good health care and their right to play, with Article 31 and Article 24 being connected in this way, and recognising that children's play can facilitate children's experience and aid their recovery when they're in hospital. So that's an important observation from the UN Convention and what the committee said about it. Within the policy framework, previous government guidance, this dates back to 2003, recognised that children have a basic need for play in the healthcare system, and it helps them to cope with procedures and interventions. It can hasten recovery, reduce the need for general anaesthetic. And the recommendation is that all children should have daily access to a play specialist, but also that the whole multidisciplinary team around children should be encouraged to understand and apply play principles when they're working with children and engaging with them. It's important to note here that what is behind these statements, coping with procedures and interventions, reducing the need for general anaesthetic, what really goes on in the engagement of play practitioners with children in healthcare is really mitigation of stress, trauma, anxiety, and other quite serious mental health concerns for children. Hospital can be a very scary place for children. Being sick already can be a difficult and painful and distressing experience, and the healthcare system can be alienating and frightening. And what the play specialists and other play staff do is to mitigate the risk of trauma to children going through very difficult times and difficult procedures. This is reflected in the current NICE guidance, which is about recommending good practice for children's healthcare. And it's again recognising that the provision of play opportunities and play staff can help to reduce boredom and anxiety and reduce the fear and anxiety about pain, using therapeutic play and distraction techniques during difficult procedures. Important to note the term therapeutic play and to not confuse that with play therapy. Just to make the point there that play therapy is a form of psychological intervention. Therapeutic play is what play specialists do for children in acute and other settings, and it's a mitigating the risk of rather than dealing with the consequences of it, which is play therapy. So they're very distinct, two very different practices, very different contexts. Sometimes confused, even by people who work within children's health, do tend to confuse them, but they are quite different. So that guidance is from 2021. Well, let's look at the reality. And first of all, the context for play in children's healthcare in numbers. This is not a minority issue. This is not a fringe issue. 15.5 million child hospital admissions per annum, and that is in throughout the health system, about 1.8 million inpatient admissions per year. So a large number of children are engaged in healthcare of some kind every year. The Department of Health and Social Care is a huge government department. It has a huge budget, £180.2 billion. That was the estimated spend only in England in 22 to 23. About 70% of that would be for the NHS. So we're talking about a huge public service. But the provision of play services for children in England is sporadic, inconsistent and patchy, to say the least. Fewer than 1,200 staff, including about 570 health play specialists. These figures are a couple of years old now, it has to be said, from a Freedom of Information survey that we did in 23-24. So that would have been for the year up to 23. 651 registered health play specialists across the UK. I can't read that one because my screen is in the way. There we go. Around 50% of health play specialists work part-time. Only 15% of NHS trusts have any kind of play policy or guidance. And because the profession is not statutorily regulated, there are, we know there are numbers of unregistered practitioners because trusts are not required to employ registered practitioners. Many play services only open for 5 days a week with no cover at weekends. 72% of healthcare settings have no budget for play. And we estimate that around 3,000 new full-time staff are needed to provide any kind of optimal service for children. Again, this is just for England. And to provide cover in A&E, which is of course a 24/7 service, that number would be even higher. So to try and address this huge shortfall, NHS England asked us to jointly chair a task force on children's play in healthcare, which met between 22 and 23. And that was a huge exercise involving over 60 professionals and all the key organisations, jointly chaired by NHS England and Starlight. And we have produced together new guidelines for healthcare commissioners and NHS trusts in England, recommended standards and a checklist for health play services. And those two documents are being prepared for publication soon. We don't know when yet. And we are very patiently waiting for those to emerge. We understand it will be quite soon. And we ourselves have published a report of that work, which is called A Common Purpose, and our own workforce development strategy, which NHS England asked us to produce. And that's another document that you can find on our website. The workforce strategy addresses the issues of capacity, capability, professionalization, and recognition as the 4 pillars of a strategy that over time we reckon can produce 1,000 new health play staff over 3 years. And if we repeat that over subsequent periods of 3 years, we might be getting close to the numbers needed to provide an optimal level of service. We're making the policy case to government. This was our manifesto, and we're pushing that agenda hard. See what I did there? And what we're asking for is for that level of cover to be provided 7 days a week. We initial 1,000 new health play professionals over 3 years. We want the guidance and standards to be published. We want there to be training for all children's health professionals in play, and for play to be integrated within commissioning and design for children's health services. And we want this all to be led from the cabinet. From thinking about play sufficiency in the context of healthcare, general comment says that all children should be given sufficient time and space to exercise these rights. In the context of a child who's undergoing scary finding procedures, maybe has mobility problems, and in the hospital environment is constrained anyway, the concept of space becomes a different question. And I think what we're really talking about is agency, choice, and empowerment. And this is the role of the play team to help children to be more engaged, so that the trauma of having things done to them becomes less of a problem, because what the play team will do is enable the patient to become engaged and have some agency in their own treatment. And just finally, I'll leave you with this. This is a diagram modelled on the personalised model for universal healthcare that NHS England published in 2019. And for the new guidance document, we've adapted it for health play provision. And it's a kind of, looks a little bit complicated, but it's basically simply saying that the higher up the pyramid, the more concentrated and intense the resource is required for children in healthcare. And the aim of health policy is, of course, to have more people further down the pyramid. So we're talking about prevention, community health. And this is a model that we've adapted for the health play context. Looking into the future and play sufficiency, the proposal that we're making is that if we really talk about an upstream health policy that recognizes the importance of children's play in their health and well-being as an issue of public health, then statutory play sufficiency duty on all public bodies, not just local authorities, should be part of an enlightened policy for children's health, as part of the government's vision for raising the healthiest generation of children ever. And that's the end of my time. Thank you.
Fantastic. Thanks so much, Adrian. You raised some important points for debate there, I think. Very important points. It will be good to finally see the toolkit with commissioning guidance and recommended standards for play in children's healthcare published by National Health Service England. That's been a long time coming. I can say that, you can't. I want to pick up again on the bit that you were saying at the end on your integrated model, which and I really like the kind of play sufficiency bit at the bottom, raises all sorts of questions about who the duty is on. And because of the way that health services are structured in England and possibly the UK, I don't know about other countries, if the duty is on local authorities, then there could be some public health involvement there, but certainly not the National Health Service, even though they've been moving towards more integration. And I think that's quite an interesting question for people to consider. And it raises all sorts of questions about where play sits. We have eternal discussions about who should the lead department be in central government, who should the lead department be in local government for children's play, because play permeates every aspect of children's lives. So in Wales, it's framed as a poverty issue within the children and families measure. In Scotland, it's part of planning around the place principle, and you've made a really strong case for it to be health-based. In England yesterday, I was at the House of Commons for the launch of the Play Commission's interim report, and they are suggesting, going back in time, that play strategy has the Department for Culture, Media and Sport as its lead department, recognising the need to work cross-departmentally. Thank you very much. So we've had three different perspectives on play sufficiency at national level from a policy perspective. So let's turn now to two UK countries who have yet to have any statutory duty using the concept of play sufficiency. And turning to our commentators, our pundits, our experts. So Eugene Minogue from Play England and Alan Heron from Playboard Northern Ireland to see what they can draw from these examples and for their own campaign work in their respective countries. Let me introduce them first. So, bringing over 25 years of senior leadership experience in local government, Eugene Minogue has delivered transformative strategies across play, youth, parks, health, well-being, physical activity, leisure and sports services. Alongside his local government career, he's held roles at Sport England, at Parkour UK, where he was CEO for 10 years. He's currently the Executive Director for Play England and is the founder of the No Ball Games, so KNOW, play on words, No Balls campaign, which campaigns for the removal of no ball game signs, NO ball game signs. Welcome, Eugene. Alan Heron was appointed Chief Executive of Playboard Northern Ireland in June 2022, having worked there since 2009 as Director of Service Delivery and Development. During his time with Playboard, Alan led on the development of Northern Ireland's first ever play and leisure policy and implementation plan in 2011 and secured the embedding of play within the Northern Ireland Executive Children's Services Cooperation Act and the Children and Young People's Strategy. Alan has also led the development of council play strategies across Northern Ireland and the Republic of Ireland, so at a local government level. So welcome to you both. I'm intrigued to know what you make of what you've heard from the Welsh Government, from the Scottish Government, and from a health perspective. So let's start with you, Alan. My opening question is, how does what you've heard help with your advocacy work in Northern Ireland?
I think from a Northern Ireland perspective, Wendy, the more I kind of look at it, particularly in terms of the Welsh and Scottish and the journeys they have been on, I kind of feel we're in a halfway position in terms of recognising play sufficiency and the need to embed it at a strategic level. The right to play is recognised within Northern Ireland at a regional policy level. So you referenced the play and leisure policy, which goes back to 2011. So the right to play is embedded within it, and the right to play is also embedded within the Cooperation Act and the play strategy, or the Children and Young People strategy. What we really don't have is an explicit play strategy within Northern Ireland, which highlights and embeds the role of play sufficiency in driving play at local community level. And that has meant that we as an organisation have almost had to move the advocacy strand from regional to local, which is why you see the development of the work at local council level. So we have, for example, supported 7 strategies, play strategies within 11 councils, all of which have key elements of play sufficiency embedded within them, and they're all built on the right to play. Now the challenge for us in that is the successes we have had at local level have largely been down to quite long-standing and successful advocacy with individuals in councils. So we've brought supporters on board who have been willing to embed play sufficiency approaches. The challenge is, should those individuals move on, then the whole thing could come crumbling down in the absence of a regional policy framework and regional legislation. So for us, the successes at a local level, which have been quite significant in terms of some of those strategies, we have seen quite a lot of investment in both fixed and non-fixed play, but we really need the play sufficiency to be embedded right at the very top of the legislative structure within Northern Ireland to secure and I suppose to protect the progress we have made.
That's really interesting. Thanks. So I think something like that is happening in England as well. I mean, I'll bring Eugene in a minute. So some stuff is happening at local level, but you're right, people move on, and unless it's actually embedded in something statutory, it's not sustainable. So Eugene, I'll ask you the same question. How does what you've heard from the 3 speakers today help you with advocacy work in England?
Yeah, thanks, Wendy, and it's a pleasure to be here today, and also to hear more about play sufficiency. You learn more and more as we spend time with each other and share better practice around stuff. There's a lot going on in England. I think, for me, I think it's important to point out some contextual bits right from the outset. So England, we don't have a devolved parliament, so it is the UK government. So it's very different than the other home nations with that. So we can see the great work that's been done in Wales and Scotland, and the strides that's been made there. That said, there is benefits that may be coming with the devolution bill, which I'll come back to in a little bit, and where that sits with certainly with place efficiency. But also, since 2010, we've had very little policy context and strategy context at government level in England now, since the coalition government sort of came in, and that sort of, want for a better phrase, put a red line through a number of initiatives, such as the play strategy, but associated sort of facilities such as short arch facilities as well. So that had a compounding effect, particularly in England, and play largely has been forgotten and or sidelined or squeezed out with other elements that happen from a policy sort of context. But we've been working hard to change the policy framework around that and the narrative, and we have started to see some real tangible movements on that as well. So certainly from Play England perspective, we've been advocating for place efficiency for many years, but we really ramped that up in the summer of 2023, which culminated with our formal manifesto, which we had to get out a lot quicker than we would first anticipate for various sort of different reasons, but we managed to launch that on the 1st of February 2024, which really framed place efficiency. And I would encourage people to have a look at some of the ideas that are in that manifesto on our website around how it could be brought into meaningful practice. And that was really taking the great work that's been done in Wales and Scotland and standing on the shoulders of that, if I'm honest, and taking the best bits from those and how we can put that in an English context or a UK legislative context. So we've been working hard on that front, and then we've started to see some incremental things happen, particularly since the change of government. We've had to be fleet of foot with the election being called. Unfortunately, that put a pin in really good things such as the children, young people inquiry in the built environment as well, which was generating some real momentum, real interest. But unfortunately, the election sort of put a pin in that. And then we've had to move quite quickly to work with the incoming government now, the current government, around that. And we've really ramped the narrative up around it, and we're starting to have some tangible outcomes. We've had some small wins, such as closing the smoking loophole, where you couldn't smoke at a pub, but you could in the children's playground. So we've managed to get government to tighten up that loophole with the tobacco and vaping bill. But there, more importantly, the stepping stone towards place efficiency legislation has really been around the national planning policy framework. So we managed to get an amendment to that, paragraph 104, but we're sort of saying that's not enough. We're very clear that's not enough. We need to go much, much further and implement place efficiency. So there's a real policy opportunity happening, particularly in England, around a number of bills and the government's current legislative programme around that. So the MPPF was off the back of the consultation that they done back end of last year. But also there's movement happening now with the introduction of the Children's Wellbeing in Schools bills. We've submitted an amendment to that bill to insert a new clause around place efficiency on that front. And we also have another opportunity when the Planning and Infrastructure Bill comes forward to Parliament in the coming months around that. And like you rightly mentioned yesterday, was the launch of the Play Commission report, which again supports the concept of place efficiency amongst many others that are out there, TCPA, Save the Children and others. We're all banging the same drum, but there does seem to be some momentum around it currently. So taking advantage of those opportunities, as I said, the Children's Wellbeing in Schools bill gives us an opportunity to implement something that is a little bit more holistic, or potentially a little bit more holistic in terms of how you implement place efficiency, leaning into the Wales sort of approach a little bit more from that point of view. But if we're unsuccessful with that, we will try again with the Planning Infrastructure Bill, with that leaning into the Scottish model. Now, they sound like you're compromising on one or the other, The irony is where the detail actually really lives would be in the secondary legislation or the statutory instrument. So where we get it, yes, the wording does have some impact in terms of how it's framed, but a lot of the detail would live in the secondary legislation or the statutory instrument. So we're clear on that around what we can do. But then there's the bigger sort of advantage of what's happening. If we can get it in one of those bills, which I'm fairly confident of, you have to be with these things and keep driving it forward. And we are generating some real political momentum with it, whether it's the recent parliamentary debate, which spoke for itself around the cross-party consensus around it, but also with the State of Play report yesterday, and the number of MPs that are just going, yes, we should be doing this, and we need to improve the life of children and young people through play. So that's still there. The bigger one is around devolution. The devolution bill that comes through in England, they are shaking up how local authority is structured with that. One of the interesting pieces around that is where play could potentially fit within that. So there is a move towards unitary authorities and then strategic authorities with it as well. But the other interesting piece, which isn't directly related to us, but will have some bearing, is around coterminous boundaries for other public services, so health, police and fire, as a couple of examples as well. So there's some real opportunities in England, and we continue to highlight the great work that's going on in Wales and Scotland and elsewhere. And also some local places that have chosen to implement place efficiency quite freely, such as Leeds.
That's a really full response. Thank you very much. And it does raise, I think it raises a lot of questions around, you have to be a policy nerd, you have to know what's going on if you want to get this in at national level into law as a statutory duty. And I know that there's always been an element of taking what you can when you can. So which actual law it gets put in is what happens to be around at the time, sometimes being very, very realistic about it. And I like your point about that. You know, you look at the detail in the secondary, in the regulations and in the statutory guidance, the kind of secondary policy instruments that come from that. A really interesting point about devolution, where some of the boundaries between public bodies may, at the moment, it's a terrible mishmash in England, and I think that may get over some of the issues about what do we mean by a public body, and are we asking local authorities local government to take this on, and where in local government. So I'd like to open that discussion out, if I can, and bring everybody back into the conversation, and hoping that Ben and Mike have been weaving their magic on the questions for everybody as well. So I will kick this off with the question about who should if there is a place efficiency duty, a statutory duty, who should it be on? There's an open question.
Do you want me to start that off?
You can if you like.
Yeah, I think given everything that's going on in England, it's going to be local authorities. Now, the bigger question would be whether that sits with what is going to be known as a strategic authority, or what people know as a mayoral combined authority currently, or whether that would sit with the unitary underneath it. The policy landscape is in flux at the moment. Nobody really knows what it's going to look like in England just yet. So there's lots of discussions around what goes up, what stays down, where does it go. As an example, spatial planning and housing. There's a lot of discussion around whether that moves up the strategic authority, the combined authority level, so they can look at it on a bigger place-based basis. I suspect it will sit with both at some point. So from a strategic point of view, housing, it would sit a much broader level, but in terms of a local level, it would be certainly local authorities on that, depending on what they look like in England over the next few years.
Okay, Alan, do you have any thoughts about that? About who the duty should be on, and you know, how it may work across local government and health boards in Northern Ireland?
Yeah, I mean, I think the primary area, you know, we consistently come up about in our work, both at regional and at local government level, I have to say, I'm speaking to politicians, it is the planning policy seems to be the crux of the situation within Northern Ireland. I would say, you know, and we sort of have this, we deliberate this quite often in Northern Ireland, you know, where should this sit? And the reality is my concerns about placing it in planning is it almost becomes sidelined into one specific area, and it becomes very much focused on, you know, residential development planning and so on. And we actually miss out on all the opportunities we need in order to impact on children's play within schools, within youth settings, you know, within all of the other spaces that children find themselves. So I think there's always a concern for me if we sideline it too far down into one specific route, we miss out on multiple opportunities. And I think that's been our experience in Northern Ireland when the successes we've had at local level, you know, the difficulties at time are because they are so ingrained within the traditional structures within councils. So a lot of the focus goes on fixed play parks. A lot of the focus goes on, you know, council owned land and so on, which really limits us in terms of what we can actually achieve in improving play for children and young people. So it's a bit of a fudge answer. It almost needs to fall right across the board. I mean, we've kind of settled in Northern Ireland that play sufficiency needs to be based within the central component of government. You know, in order to then, you know, to be able to, I suppose, flow down through the other departmental responsibilities, because that's really the only way we will get an effective policy that will hopefully deliver. So that kind of would be my answer. So there's no one single place really.
Yeah. I think you're right, and making it a duty to work cross-departmentally helps as well. There are 3 hands up, and I'm afraid I didn't notice who put theirs up first. So do you know if you put your hand up first?
I think Marguerite was before me,
Okay.
that's for sure.
Marguerite, let's go to you.
So we were very clear at the outset, we wanted it in planning, and that's been the campaign. But the legal duty in planning is not a legal duty for children's right to play. That's not enshrining the right to play in law in Scotland. What enshrines the right to play in law is the UNCRC coming into Scots law. So I think sometimes people assume that the PSA legislation is the right to play legislation in Scotland. It's not. So it's 2 different things. And I agree with planning that it's local authority priorities, whatever that's configured in each nation state. But I think when it comes to the legal right to play, it's been extended in Scotland beyond local authorities to something they're calling public authorities. And that would include organisations like Play Scotland that get money through another party, Cora Foundation, but it's government money. So any of us in the broader public sector, not the public sector that delivers services, but those of us that receive funding in the public from the public sector and broader are known as public authorities, and we then have duties placed on us as well. So I think there's 2 separate things here, and sometimes people think the play sufficiency is the legal duty, the right to play, and it's not. That's something different in Scotland.
Can I take Marianne next, Adrian, because I think what Marianne says might follow on from Marguerite in terms of national government policy. Have I got that wrong, Marianne?
That's okay. I'll be brief, but I've just a few things. I think, you know, we are 15 years on from the enactment of the measure, so it's easy to look back and think, what have we missed? And so the Ministerial Review of Play picked that up a little bit in terms of who the duty should be enacted to, and there are other bodies such as, and you've mentioned NHS and you've mentioned public health teams. There are obviously other bodies who have an interest and need to be held accountable in terms of what they do for children's play. But very often you're limited at national level in terms of where your powers sit and what you can enact. And as you already mentioned, Wendy, the piece of legislation which is going through at the time, because the programs for government get set and are then set in stone for 6 years or so. One of the things that the Ministerial Review of Play steering group recommended to Welsh Government is that it considered a charter for children's play that other bodies could sign up to. So although it's not necessarily placing a duty on those other bodies, such as Sport Wales, Natural Resources Wales, again, NHS Wales, it gets them thinking about how they can play until we're in a position in Wales to review the laws around children's play, because changing laws are very different than changing guidance. But I think I would encourage anybody who's thinking about whatever act is hot topic at the time, or whatever bill is hot topic at the time, just try to get that breadth of information through the play sufficiency assessments about, you know, everywhere where children play, so that everybody is thinking about it, as Alan said, is, you know, thinking about play parks is one thing, but you know, we need to think about how children get to those parks and what the tolerance is like when they're in those parks. So really, just wherever it sits, if the consultation is rich enough, you will be able to pull everybody who impacts on children's play. And, you know, Welsh Government have a really nice definition of the play workforce, and it's basically everybody.
Yeah.
You know, it's everybody whose decisions impact on children's play. I'll stop now. Thank you.
Yeah, no, that's great, thanks. And yeah, so keep that broad perspective. Wherever you don't pigeonhole it anywhere, and just use wherever it is as a way to bring everybody else in, I think. Adrian.
I love that. Yeah, everybody that either works with children or whose work affects children. And I think that is the implication of the UNCRC, that these rights apply to the entire public realm, including public services that children may encounter in their lives. And we know that children play everywhere and anywhere, given half a chance. And I think that the full implication of really adopting a play policy as a principle for the realization of that human right is that every single public body whose services or whose decisions impact on children's lives in any way needs to specifically adapt the right to play and what it means for their culture, their service, their work. But that's an idealistic perspective, of course. But you know, 30 years ago, it would have been thought to be pie in the sky.
Yeah.
The work that is going on now in Wales and also in Scotland. So, and you know, I'm sitting around this seminar table, virtual table now, with some of the same people who were working 30 years ago, and look and see what can be achieved. So I think that vision for a genuinely cross-cutting whole government, whole public realm adaptation of children's right to play must be our long-term vision. Pragmatically, of course, local authorities have a key role to play, but so do schools, and we mustn't give up on schools. And what I've learned from my last 4 years is that, you know, children become invisible when they enter the healthcare system to a large extent, and yet their need for play opportunities and to be supported by play practitioners is never more acute than when they're in that space. And so that's a really important area of children's lives. And just finally, I honestly don't understand the thinking. I haven't been part of the discussions, and I respect there must have been some considerable discussion before the Play Commission has come out and suggested that it should again be the Department for Culture that leads on this. Experience back in the noughties was that we got no serious government movement on play until it was taken on by one of the big spending departments. DCMS, you know, they told the lottery to spend some money. They told Play England to spend, Sport England to play some money, but they don't have their own big budgets, and that gives them very little power to lead what is really needed, which is a whole government approach. So, you know, unless there are very good arguments that I haven't heard, I'd be strongly advocating for either the Department for Education or the Department of Health, or maybe even the Department for Communities, which is all about the built environment, for one of those three to be taking the lead on a new play strategy.
Okay, I think Eugene wants to respond to that. And after that, can we go to some of the questions from the chat?
Yeah, Adrian, we've had discussions. Broadly, I'm in agreement with that. I think the rationale behind it is because that's where the current youth strategy is sitting, and also the DCMS is there's benefits in it being a relatively small department because you can have more visibility within it as opposed to a bigger department, but I don't disagree with what you're saying. One of the things that did come out of the discussion yesterday at the interim report launch was whether the Department for Education should be renamed again to the Department for Children, Families and Schools with it all. And given the broad remit of the DfE currently is everything from HE and apprenticeships right through to early years and everything in between. So there was some of that discussion in there at the moment, and I think there is some realisation within government that this does need to sit somewhere. My personal view is, if it was to sit anywhere, Cabinet Office would be my go-to.
Yeah. Okay. Ben and Mike, what have you got for us?
Well, I think one of probably the easiest accessible questions for this national seminar, because there's a big question around the research ethics. National governments are asking local authorities to do research with children to establish an evidence base for making change. And there's some of that, the very detailed stuff around ethics and the primacy of children's contribution that we'll deal with in the next two seminars. But I think particularly for this one, it's what are the national government's procedures for checks and balances of the work that local authorities do in their place efficiency assessments, because there must be a huge diversity across local authorities' responses, and how do governments check in on that have legislated for place efficiency?
Yeah, do you want to respond, Marianne?
Yeah, I'll come in quickly in terms of how Play Wales is involved in that, and wanted to pick up a little bit in terms of where Play sits. I love the fact that it sits in lots of different departments across the 22 local authorities. And I think it kind of embraces that notion that everybody has a role to play. I know it's more tricky at national government level, but certainly that's the case in Wales. So it's where Play sits is very much at local authority discretion. So where place efficiency responsibilities are coordinated from. Welsh Government calls in the place efficiency assessments and the action plans and progress reports that I described earlier, and then asks Play Wales to review them. So the 22 place efficiency assessments at that submission every 3 years, and we produce a report called State of Play, whatever year that is, and provide it to Welsh Government. And it's a collaborative report. We bounce it back and forth, and they ask us to identify the commonalities in terms of the issues impacting at local authority level. And you're right, the depth of information will differ depending on who is leading on that place efficiency assessment. So if Play sits within a play and youth work team, the depth of information within the matters which look at that issue will be deeper and richer. And that's just how it, and likewise, if it sits within sports development or if it sits in education. So the rejigging of the tools which support place efficiency are trying to give a little bit more coherency across place efficiency assessments. Welsh Government then is keen to provide feedback to local authorities, and I know they're in the process of starting to compile that so that local authorities will get feedback on the progress reports and the action plans, which are in the kind of the arena at the moment, where they kind of recognize where the strengths are in the local authority, where some of the challenges might be, and something that's of particular interest, because right across the 22 local authorities, but both in the progress reports and the place efficiency assessments, we're always able to find a bit of sparkle. Yeah. And I think the fact that the duties were commenced on a low cost, a cost neutral basis. So there wasn't necessarily any funding alongside this, although funding has been made available over the years, as Ruth has mentioned. And that, I think the cost neutral basis meant that there had to be a dialogue, there had to be a community of practice, and people had to be enchanted enough to experiment and try new things. Yeah. I will continue to advocate for more money and argue for more money for Play until I am grayer than I am now, but let's not throw things away just because we haven't got money, because we can still do things differently. Sorry.
Absolutely, yes. I get that argument. That's great. We could carry this on, but sadly, it's time to bring things to a close. It's always just as things were getting interesting, isn't it? But it's been interesting the whole time today. Thanks so much to our stellar group of speakers and panelists who have told us about the amazing work that they're doing in support of place efficiency. So thanks Marianne, Ruth, Marguerite, Adrian, Alan and Eugene. Let's hope what feels like a policy moment, it certainly does in England anyway, can come to fruition. Thanks again to Play Wales and Genero for their support for this. And to those of you that have asked really interesting questions as well, and thanks for attending today. We'll let you know when the recording's ready. You will be sent an evaluation form. Please fill it out. We know these things aren't perfect and we can always get better. And if you want to come to the next webinars, please register. The next one is on Tuesday, the 1st of April, same time. And it will look at place efficiency at local government level. We have a fantastic range of speakers lined up for you who are doing place efficiency at local government level across England, Wales and Scotland. So I will leave it at that and say thank you very much to you all.